Hey everybody, it's Dr. Cole. Today we're going to talk about an article that I wrote for mindbodygreen.com about the subject of cholesterol, and it was entitled, Does Cholesterol Cause Heart Disease? I'm going to leave the link for the article at the description box at the bottom of this video, and I'll also post it on my blog at drwillcole.com. But I just really want to get this message out there because I consult thousands of people all across the country in this subject of cholesterol, and I see so many people on these statin drugs, these cholesterol lowering drugs. It's the largest class of drugs in the United States. It's a multi-million-dollar industry, the cholesterol lowering industry. But the fact is, the science really doesn't hold up, and the fact these drugs are widely overprescribed. And the fact of the matter is that total cholesterol and high LDL is a really poor predictor for heart disease. So this whole sham of just shoving the cholesterol to really low levels has actually been wreaking havoc on millions of Americans. Their hormone production is just in the gutter. Men's and women's sex drives are just non-existent because their cholesterol are at unhealthy low levels. And the research is clear that more people die of heart attack and strokes with low cholesterol than the people with high cholesterol does. So this is just a big, huge moneymaker for the pharmaceutical industry, but is actually wreaking havoc on millions of well-intentioned Americans and well-intentioned people all across the world. So I really want to just sort of disseminate this information, but there are good predictors of heart disease. I would say that high HDL, you want to make sure your HDL is high. So low HDL is a good predictor of a heart attack and stroke. We want to look at high triglycerides, so that's another good predictor of a heart attack and stroke. And LDL there's actually two different types of LDL. So you heard it be called bad cholesterol, but the fact of the matter is there's small dense LDL and large buoyant LDL. The small dense LDL is potentially bad, but the large buoyant HDL is actually shown to be protective. So just looking at total LDL or total cholesterol and saying, this is bad, take the statin drug to shove your hormone levels down. And again, another side note of a side effect of having your cholesterol too low, it's been linked to neurodegenerative issues, Alzheimer's and dementia. So we need cholesterol, we need hormone production, and just sort of shoving it down with pharmaceuticals is not the answer for ultimate healing and ultimate wellness and decreasing the risks of heart attack and stroke. So we need to look at the level of the small dense LDL. This is a good predictor of heart attack and stroke, but it can't be looked at when they're just looking at total cholesterol LDL levels. But the reason why they do that is because what's the standard model of care? It's to diagnose a disease and match it with a corresponding drug. And all they need to give you the corresponding drug is just to look at the total cholesterol and say, look, let's match this number, this cholesterol number with this statin drug, with this whatever the drug may be. But we aren't concerned here with functional medicine. I'm not concerned with just looking at matching the disease with the drug. I'm looking at what's going on underneath the surface. What is the ultimate cause of what's making you feel the way you feel, or why you're going through what you're going through? So we need to look at small dense LDL versus large buoyant LDL. It's done very easy with a test called NMR, or nuclear magnetic resonance, and a test that I run on my patients, again, all across the country through my virtual functional medicine practice. So you can go to drwillcole.com for more information. You can set up a free evaluation. The other predictors of a heart attack and stroke is going to be inflammation. The research is very, very clear at the inflammatory link between heart attack and stroke and a lot of other chronic diseases. So we have to look at such biomarkers such as C-reactive protein, which is a good predictor for systemic inflammation and a good higher risk factor for heart attack and stroke, and also looking at homocysteine. So these inflammatory biomarkers we can run very easily on blood labs. So again, check out drwillcole.com for more information, and you can set up a free evaluation if you want to just get off this pharmaceutical merry-go-round that's just where there's no end in sight, and the only thing that's going to change in 10 years of your life is more and more drugs and more disease processes, because they're not dealing with the ultimate underlying cause of why you're sick. And these drugs are not designed to heal. They're designed to manage a disease. They're designed to kind of bully the body's physiology and make numbers look really pretty on a piece of paper, but they're not bringing people wellness. They're not bringing people healing. And look, statin drugs, I've named some of the other side effects. There are many other bad side effects. And again, one of them is an increased risk of diabetes. So a lot of diabetics are on these statin drugs, but they're on blood sugar medication as well. So they're bringing medication to bring the blood sugars down, and then they're on statin drugs that has been shown in the research, and the FDA has made it clear as well that yes, statin drugs do increase your risk of diabetes. So this is just part of the insanity, and doing the same thing over and over again and expecting a different result is one definition of insanity, and this is definitely insanity in the standard model of care. So I would ask yourself a question: what is the most effective that causes the least amount of side effects? If those drugs fit that criteria, then take them. But the fact of the matter is, most drugs do not fit that criteria. So with functional medicine, we're able to be the most effective with causing the least amount of side effects. So again, check out drwillcole.com. Check out the link to the article where I can extrapolate a little bit more as far as the research is concerned to really go over this topic of cholesterol, the topic of saturated fat, and the topic of heart disease.